Hello, everybody. Oh, we have someone raised a hand. So, can you see what the question? Could you pop your question in the chat? Can anyone see that?
So no open questions as yet.
Oh, okay. So this is the first time I have used Zoom. So I must apologize if we look like we're working our way out for a webinar tool. We run hundreds of webinars, generally obviously generally using Teams, so I'm more familiar with that. So if I'm asking questions to my colleagues, please bear with us a little bit. So we've recorded this, or we are recording this. If anyone has an issue with that, please let us know afterwards. As with all of our webinars, we like to keep things open and interactive. So if you have questions, please pop them in the chat. What I'm going to do is to run through the presentation. We'll take some breaks and some pauses to allow you to ask some questions, some important stuff, so you can visualize how MyBotGP would be working in reality at your practice. And then we'll take things from there. In advance, I just want to pre-warn everyone, there's a very strong possibility I may cough. So I have a glass of water here, and periodically I will chew something, chewing gum. So it's not because I'm eating and drinking, so just so I can get through this call. So I'm going to start now. MyBotGP range. What we're going to run through today is our Docman filing automation. I have John and Sanjeev supporting us on this webinar. So between the three of us, you have sales, operations, and technical. So hopefully we've got this covered. MyBotGP has three products for EMIS. I would imagine everybody on this webinar uses EMIS because this is a document automation tool. Our three core products are normal pathology management, where not all normals are normal, is the way we like to describe that, a self-configurable platform that will read all of your pathology tests, and you can add rules to it to determine whether path tests coming back from the lab as normal need further investigation. Some clients are using that to look after 200 different pathology tests. We have our document automation platform, which we're going to run through now, which essentially is designed to look after document for you. And we have a repeat prescription automation, which acts as a big filter and will filter out all of your repeat requests defined by regime and review date to save time, clinical and administrative time, enable you to get through your authorization or not authorization of repeat prescriptions quickly or quicker. Quick bit about us. We won't spend too much time on this, as the important stuff is that you're going to want to understand is how it works. You can see here on the right-hand side, we're actually an NHS ICT partner. That doesn't mean we're an NHS organisation. My connection is unstable. I don't know why that's showing up. That's gone. We're an NHS ICT partner, so that means that all of our kit lives in an NHS ICB hosted environment, cloud environment. Why that's important? Well, it means we can install very quickly. All of your data is safe and secure, so we tick all the boxes for DTACs, DPIAs, data sharing agreements. It's quite unusual for a private company to have access to an NHS environment, so we're very proud of that. And within a short space of time, if you were to acquire any of our products, they would be spun up basically in an NHS cloud. All of our tooling has DCB 0129 certification, which is an NHS prerequisite for clinical risk. We also have template DCB 0160s that we're able to share for our clients once they've onboarded with us. DCB 0160s are around how you would use the tool if you acquired it, and that DCB 160 template can be tidied up at your end depending on how you want to run it. We're also part of the Health Innovation Launchpad program, which you can see here, which is a government-funded program to help innovation in tech, essentially in healthcare. We completed that a couple of years ago. That's enough about us. The way that we work with practices and we work with PCNs. We have different packages for practices and PCNs. Obviously, there's different scale when working at a practice or a PCN. So our kit can be acquired at practice level, very straightforward. Or more recently, lots of PCNs have been making acquisitions. What that means is we have a very quick deployment model for PCNs in terms of a centralized DCB 0129 and 0160, centralized reporting, and a very quick deployment. So as a minimal footprint at PCN level in order to acquire our tooling for every practice at the PCN. The good news is that MyBotGP is still configurable at practice level. So even if acquired at PCN level, every practice retains full control over their bot. And that would be for pathology management, Docman, or repeat prescription filtering and authorization. Why is that important? Well, it's important because you all work in different ways. You all are staffed differently and make different decisions around how you process letters, manage pathology results, or authorize repeat prescriptions. So having full control means that this tooling can be acquired at PCN level and everyone will want to use it. If we move to the next stage, by request, we've updated this slide. It's an overview of perception of time. And what we're trying to say here, or what we are saying here, is as people, we're not very good at reconciling how long things take. We all do things every day. We do the same thing every day. We make coffee, we make toast, we go for walks, we get changed, a couple of minutes here, a couple of minutes there. All of these, what feels like small snippets of time, when you add them up, actually add up to a considerable amount of time. So if you take that scenario into Docman, which is into letter management, which is what this presentation is all about, and the same principle, obviously, with PATH and repeats. An average working week in the UK, which includes breaks, is about 40 hours. Now, we're very well aware that lots of you work more than 40 hours a week in primary care. We're not saying everybody works 40 hours, but it's a good benchmark. An average working week in the UK is 40 hours a week, and that includes lunch. And so for those of you that take lunch, daily tasks take longer than we think. Unbelievably, 15 minutes a day, if you sit down and think about it, equates to 91.25 hours a year. 30 minutes a day equates to 182.5 hours a year. And 60 minutes a day equates to 365 hours a year. So doing something for 15 minutes, 20 minutes a day, 10 minutes in the morning, 10 minutes in the afternoon, half an hour here or there, it doesn't feel like a lot of time. When you ramp that up over 5 or 6 days a week, depending how many hours people are working, it's a lot of time. If you think of an average working week is 40 hours, and 15 minutes a day over a period of a year equates to near on 91 hours, 2 weeks. So letter management, as we know, takes a lot longer than 60 minutes a day, and more than one person's involved. So it's pretty straightforward to make a statement that this takes a lot of time. And any help that you can get in reducing the footprint of how many people you allocate to this task and how much time they allocate to this task, and improving the accuracy of this task will be well received. So this leads into the next slide. An average practice with a list of, on average, a practice with a list of about 8,500 patients receives approximately 125 letters a day. If you think about that, that's a staggering 39,000 letters a year, approximately. Some of you at that size will receive some more, others will receive fewer. That's an average. So an average, on average, a practice with 8,500 patients will receive 125 letters a day. So that's a staggering 39,000 letters a year are manually need to be looked after by the practice. And all of those at the moment, whether you're using IntelliSense or not using IntelliSense, are currently being manually validated against the letter and the patient. Templates are being completed and decisions are being made around what needs to happen with that letter. Do they need to go to specific people? Do they need to be looked at? Don't they need to be looked at? Are there key words that need to be picked up? Do they need to be put through a template? Do they need to go to specific folders? This is what you're doing daily, as you know, which is why you're on this call. And you're doing that with every single letter. So even if it's one letter, you might get that same letter 50 times in a week, 60 times in a week. And every single time you're following the same action. So what MyBotGP is built to do is to do that for you. It essentially uses Docman for you. So it's like employing a new person. It will take full control of Docman for you. You tell it how you want to manage your letters. You tell it where you want your letters sent. You tell it what date to look for. You tell it what keywords to look for on the page, and it will do that for you. And it only needs to be shown once. We offer a configuration service as well. So anyone that acquires MyBotGP, We will configure it for you because we know how busy you are. And then we have online weekly client training only webinars and YouTube channels to show you how to become familiar with the tool. So when letters change and new letters come, you're able to manage that yourself, and you're able to manage and navigate through the audit logs, so you can do your reconciliations and double checks and all the stuff that you do at practices to make sure nothing is missed out. So MyBotGP will manage all of this for you. It will validate the patients, and we'll show you how it will validate the letter, will distribute the letter. It will ensure that letters are dealt with quickly to support outstanding care. It will help you get back thousands of hours a year, even based on a minute a letter or 2 minutes a letter. And we're not machines, so people don't do letters back to back to back to back to back. There are gaps, interruptions, and so on and so forth. You can see how this number, when it equates to time and amount of people, spins out of control. Increased resilience to support staff shortages, so sick leave, people leaving, you'll have something that's looking after that for you. Freeing staff time at the practice, which is something you need to do so you can focus on more complex work, like navigating through complex letters. Also, quicker processing of letters to stop to improve patient care. I had a text this morning. I'm not going to go into the detail of it. I had something yesterday, got the text this morning. I didn't ring the practice. So you're saving clinical time as well with letters being processed quickly. So MyBotGP is a remote Docman worker. It uses Docman. So if you try and put this in your head and envisage what that means, it means essentially all of the functionality you have in Docman, you can still take advantage of. The benefit of this tool is you don't have to do it yourself. A machine will do it for you. And doesn't make mistakes as well. Once you show it what to do with a letter, it will always do that. And we all know that with the best effort in the world, as people, we run at roughly a 10% error rate. So you show MyBotGP what to do with each letter once. Second time you do that, it won't ask you again. All letters will be filed and triaged straight away. Works with or without IntelliSense. It's continually checking Docman by itself, just like a person, to access all letters and emails. So yes, it can manage all of your emails as well. So anything that you get by mail, you can forward an email in. I can confirm that our tooling will also look after NHS and non-NHS letters, which is a more recent update to our tooling. So what that means is it doesn't necessarily need an NHS number to confirm the identity of a patient. So private referrals can be included now as well. It's a Docman expert. If you have letters that you know in advance, you can tell it, I don't need to look at that, just file it. It can do that. If that very same letter may have a keyword in it, like safeguarding or suicide or whatever combination of words that mean you would need to see that letter, you can provide it with a rule saying, always file this letter. I don't need to see it, like a 111 or a DNA, unless it says this word, and then I do need to see it, and it will look for that word and it will do that. Pharmacy letters, by example, could be pushed directly to pharmacy teams. You don't need to see them. If you know that in advance they will go to a different person or folder or team, it can do that as well. And it will file everything to the patient record as well. So it files everything against the record. You can make that visible or not visible, and it will triage appropriately based on your rules. Do I need to see it? Don't I need to see it? Does it need to go through a template? Does it need to go to a specific folder? Do I need to put it to a particular person? Once it's taught to do that, which we will do for you, it runs by itself. So you're saving a significant amount of time in the validation, the filing, and the distribution. So if for those of you on this call that have coding teams, they can focus on coding. For others that want stuff processed quickly and past the clinicians, that can happen as well. But what we're saying here is that any way that you're configured at your practice, if you want to keep that way of working, MyBotGP can replicate that for you. If you wanted to start to change the way that you work, obviously you can configure new protocols as well once you go live. The bulk of our clients tend to replicate how they're working because they've got tried and tested sort of protocols in place, so they know who gets what letter and where and what templates are used, and they get MyBotGP to replicate it. But again, that's up to you. Our clients are using this tool to manage hundreds of letter types. Hundreds and hundreds of them, and filing thousands a week. So what does it do? I mean, essentially, as I said, it uses Docman for you. So this is nothing new. This is the Docman template. This Docman template needs these pieces of information to be taken from the letter and added to the template. Then it needs to be saved and filed and distributed. And we can go through what that is. Validate the patient, validate the NHS number, validate the name of the letter, the type of the letter, what hospital it's from, what department, what date to look at. Do you need the event date, or do you need a referral date, or do you need it to look for a date in the bottom of the screen, middle of the screen? When you're validating where the letter came from, are you interested in whether it validates from the name at the top of the page or the bottom of the page? You tell it. So for this letter, I'm not interested in the date, the name at the top of the page. I want you to take the hospital name at the bottom of the page, and I only want you to use the date in the top left-hand corner. Next letter, blah, 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 blah. Categorizes the letter. You can add SNOMED codes, standardized. We'll file it, add it to the patient record, and distribute it. Obviously, we are not making clinical decisions on patients with this tooling. The purpose of this tooling is to get the letter onto the system correctly, enforce standardization, and distribute it appropriately. File the letters you don't need to see, just triage off the letters you don't need to see, leaving you with the ones that you do need to see, and you're saving time that it would have taken to have got that letter onto the system and filed it against the patient record and actioned it or distributed it. So yes, we can SNOMED code, obviously, linked to a letter. But when it comes to the diagnosis piece, that's not for MyBotGP. That's left for people to do. We're still working in a world where we need people and machines, and MyBotGP enables you to make best use of both of those. This is around letter distribution. Fairly straightforward, and I appreciate we're going through this quite quickly. I've just looked at the time, so if anyone's got questions, please pop them in the chat. We can come back to them. What do you want done with the letter, or what do you do with the letters at the moment? Is the best way of answering this question. We were on a call. I was on a call with John this morning, and one of the questions was how do you manage safeguarding letters? So the answer to the reply is, well, how do you manage them at the moment? I said, well, we like to put them in a particular folder, and we like a reminder. Okay. So MyBotGP will do that because it uses the existing technology that's there already. Other people might say, no, we like to put everything into one centralized folder. Okay, that's fine. But essentially what we're saying here is you configure Docman as you wish. Just let MyBotGP look after it for you. You can put any letter you want in different folders. You can push them through templates. We have some clients, one of our more recent clients, wanted MyBotGP to have a template for every letter, so they configured it that way. Other clients don't. They want some stuff through templates, some want through folders. Pharmacy teams, people roles, custom rules, task management. You want to create reviews, assign tasks, hide the letter, unhide the letter, set reminders, notify users. All of the functionality that you're using every day or not is still available for you to use. The difference with MyBotGP is you tell us what you want done with that letter. We'll set it up for you, and the next time it sees that letter, it will just action it by itself. It's not going to ask you because it knows what to do. And every time it sees a letter it hasn't seen before, from a safety perspective, or it sees a letter that's changed, it will treat that as a letter it's never seen before. So it's not going to hazard a guess on anything. It's not going to say, oh, I think I know what that is because I saw it 95% correct against another letter, so I'm going to do this. No, it doesn't. If it sees a letter that it's never seen before, it will not process it. It will put it into an exceptions folder. We have an audit log, and that audit log you will have access to, and you can open it up, and then you can add the letters back in and show MyBotGP what to do with it. So what you'll have is all your letters coming through. I know what to do with this. I'm going to send this to this person. I'm going to file that one. I'm going to send it to that person. I'm going to triage that off. That one I can file. That one I can't file. That goes to a particular doctor. That goes to the clinical team. Oh, don't know what this one is. Never seen it before. And I'll show you what the audit log looks like in a minute. That pops into the audit log. One of your team will regularly, obviously, check the audit logs, open it up, go through the letters it doesn't recognize, add them, add the rules. Next time it sees that letter, it's going to process it through. So the vision is to get you to sort of 80–90% of your letters, higher if possible, pushing through MyBotGP, freeing the team, getting letters done quickly, removing backlogs, getting hundreds and hundreds and thousands of letters a year. So MyBotGP works 7 days a week, 365 days a year. So you will always have this running in the background, clearing your backlog of letters. So hopefully you'll keep your queues at 0. Even when people are away, or people change roles, or people are off for whatever reason, you'll have support running in the background doing this massively important job for you, grabbing all of the letters, getting them onto the system, and making sure they're labeled correctly and sent to the appropriate place 24/7, 365. Here's a quick snapshot of our audit log. Pretty straightforward stuff. What do you need to see? You need to know what's gone through MyBotGP. You need to be able to reconcile that every letter that's come into the practice has been accounted for without fail. So that's all, and this is what this dashboard will evidence to you. And you'll build confidence like this with all tooling over a period of time. Anything MyBotGP touches, and that will include letters that come directly. You can scan letters in, you can email them in. So all of the letters, they will all be tagged by date, by document, and then there's a granular breakdown. And we've kept it nice and clean. You don't have to overcomplicate this, and you can reconcile back to every single letter. So you know that nothing has been missed. So you're looking at a very high level audit trail here, what's been filed, what types of letters have been filed. And at the bottom here, what you can see is just examples of letters that MyBotGP has seen and it didn't have permission to look at because it hasn't been taught. So it's saying, I've spotted these, not filed, not filed, not filed. What do I do with them? Well, essentially what you do with them is you open it up, add it. Next time it sees that, that will appear as a running stat in one of these. This is emailed to you every day. If you want to email to particular people, there's a distribution list. If not, there's obviously you can log into MyBotGP through an app, and then you've got access to the full audit log in there. So if I run this from the beginning again, and then we'll touch on pricing, then we can open up for any questions. Sandra or John, not asking to go through this now, but are there any questions in the chat? Can you give us a nod? No? Okay. No? Okay, good stuff. So just a quick summary. I know I've gone through this exceptionally quickly. All of our kit has DCB 0129. We're able to share a templated DCB 0160 for those of you that would like a copy of it to help you. All our kit lives in an NHS ICB environment, so we have DTACs, DPIAs, data sharing agreements that we can share. We're experts at working with EMIS and System 1. Obviously for EMIS we have 3 products: normal pathology management, Docman, repeat prescriptions. System 1 we have normal pathology management, repeat prescriptions. We have practice and PCN pricing and packages. Practices are onboarded very quickly. For PCNs, we've got quick deployment, centralized DCB 0129, 160, centralized reporting. Every practice would remain in full control, even if required as a PCN. You're simply the person that paid. Perception of time, I think something to really think about. We've tried a few different ways to describe this. It's straightforward for us because we work in automation, so we think like this every day. 2 minutes to put your shoes on every morning. 7 times 2 minutes, times 4 weeks, times 52 weeks. It's like hours and hours a year just taking your shoes on and off. We are not good at perceptions of time. Just something that takes you a couple of minutes every day. If you do that every single day, and everyone is, it's a lot of time. Average working week is 40 hours. 15 minutes a day is 91.2 hours, 25 hours a year. 30 minutes is 182. 60 minutes, based on 7 days a week, obviously we work 5 or 6 days a week, is 365 hours. And for a lot of the tasks you do in primary care, it's not just one person, you have multiple people. So the business case is really straightforward, especially when you start to look at that. I mean, some of our clients have got 12,000 patients, 16,000 patients. We've got some at 30, 40,000 patients. The numbers are astronomical. But again, depending on the size of the practice will define how many people you have working there and how you can cope with the throughput. So you've got the same challenges. So on average, a list with 8,500 patients gets just under 40,000 letters a year. Every single one is manually entered, validated, filed and distributed and then a portion are actioned. Massively important work and error prone. MyBotGP will take over and become a Docman super user for you, and it will look after that repetitive task for you 7 days a week, 365 days a year. You still need humans in the loop, of course. And they will be, from that point onwards, they'll be the ones that are making decisions on letters that need to have decisions made against them, something that people need to do. Although MyBotGP can pick out keywords and action them. So with the example that I gave before, all pharmacy letters distribute, or all 111 letters or DNA letters you're allowed to file because you don't need to see them unless there's something written on that letter that says you do need to see it. Overdose, suspected suicide, whatever the keywords, and it will do that for you and then push it to the right person, folder or place. It's an expert in Docman. Just going to use it for you. And our tool is managing hundreds of letter types and filing thousands and thousands of letters across the country to free up time and enforce standardization. And you can change forms very easily. I'm not sure if I mentioned this before, but I probably did a weekly webinar, client only, which our clients tend to drop in whenever they have any queries. And obviously we've got online training material and stuff. But we will configure this tool for you. So once you're onboarded, we'll configure it for you. We just need to be told what you want done with each letter, and we'll get it up and running for you. And then the ongoing management is done by you, because you're going to want to do that. You're going to want to be able to reconcile the letters and validate. And obviously, we can provide support with that as well. So this template will be completed by MyBotGP instead of a person. It doesn't make mistakes. It's not going to get the wrong date or pick a different date or pick a typo. It's brand new technology. We'll complete the template, add it to the patient record, distribute. Where do you want it to go? Wherever you can, send it within the capability of Docman. Folders, templates, people, triage, filing, sign tasks, don't assign tasks, make the letter hidden, not hidden, reminders, notifications, escalations, all of the full functionality that you're using at the moment. From a pricing audit trail, full audit log, every letter that comes through is footprinted, massively important. Distribution list that can be emailed to, also access to that online. Filings by date, document, and a detailed data view of filing granular breakdown. Where you can reconcile everything. And at the bottom here, you've got new letters that it's never seen before. Do you want us to add? Do you want me to add them? It's asking. And then adding them is pretty straightforward once you've done a bit of training. Our pricing is very straightforward. Annual subscription, unlimited letter types and volume. You could have 100 different letter types, 800 different letter types, filing 1,000 a week, 500 a week, 10,000 a week. It makes no difference to us. It's an unlimited letter types and volume based on an annual subscription. MyBotGP installation and configuration is 1999, and then it's list times 30 pence. Quite a simple calculation. So if you take your list, times it by 30 pence, add 1999, that's your MyBotGP cost. And then based on a hosted service within the NHS environment, there's an additional cost dependent on how many practices you have. So very high level, if you've got 10,000 patients, it's £700 a year. If you've got 15,000 patients, it would be 705,000 times 6 pence. Oh, sorry, £1,000. And we can send quotes and specific stuff. But if you work on the simple model of your list times 30 pence plus 1999, excuse me, that's the MyBotGP cost, and then the hosted cost depends on your list size. You take additional products with us, there's a reduction. Our other products, the normal pathology management and repeat prescriptions, they're configurable at practice level. They take a couple of hours to configure, so there's no configuration cost on that, and they're charged at £449. And list times 30 pence. And it's the same principle for repeat prescriptions and normal pathology management, unlimited path tests, unlimited volumes, and we've got some clients using it to look after 200 different pathology tests, and with repeat regime review checks, high-risk medication, all pushed through the filter. 449, list times 30 pence, and then we have an agreement with the cloud provider, 5 pence times list to have it living in an ICB. Same principle, PCM packages. We can go into more detail for PCMs that want to explore this further. PCM pricing, quick deployment, centralized security, centralized reporting. Each practice remains in full control. Okay, so I've managed to not cough, which is good for me. Do we have any questions?
James, there were just a few questions that myself and Sanj just answered off. It was mostly housekeeping in respect to sound being on and off. And there was a question around whether or not this was purely EMIS or would it work on System 1. Myself and Sanjeev explained that we are working on a solution for System 1. And Sanjeev rightly added that we do have pathology as well as EPS that is live on System 1 as well. And then Anita said that she would be interested in that attaching docs equivalent and just provided details so that we can add it to the list. No further questions at this stage.
Okay, thank you. Thank you for that. So if you have any more questions, you want to pop them into the chat. I can't see the chat, so I'll let John or Sandra let me know if any questions come in. What we can do, we have a demo that shows the tooling being configured, which is a bit redundant in one respect because we'll configure it for you, and then we can show you it working with some redacted letters that some of our clients use. With some redacted information, as one of our clients let us film that. But essentially, what you're going to see is Docman being used. So I'll stop sharing my screen and I'll get to those. Sanj, I think you're.
Yeah.
Do you want to mute up? Do you want to? Oh, that's better. Yeah. Unless you want to run through this.
I'm happy to, if you want me to.
Yeah, if you want. Yeah.
Yeah. Okay. So what we're seeing here is the Docman training screen. What we can see here on the left-hand side, where it says steps 1 to 5. Basically, there are 5 steps to train a document, and on the right-hand side is a preview screen of the letter that it's taken from Docman. First step is give it a document type name. The document title already pulled, so don't need to do anything there. And then literally it's about working out which keywords will classify that letter. So, for this example here, the example is showing we're using the words ENT clinic letter to associate with ENT clinic letter. So again, pretty straightforward. We sort of determine those keywords, for example, oncology or gynecology, etc. What are the keywords on that letter where it will uniquely classify that letter in terms of what does that document type, what is a document type? So we've given it a name, we call it to classify. Again, it automatically picks up the NHS number. So that's all done. So we set up, we validate that. You've then got a few decisions to make as to what the date setting is on the letter. Would you like it to be discharge date, appointment date, clinic date? You can draw a box around the date in terms of where it comes from that hospital. And again, it's just a case of telling MyBotGP what date to use. I think we've just gone a bit quick there, but yeah. And then there's other things like organization. So again, just telling what hospital it's coming from. And then here, step 4. If you use templates, you can ask MyBotGP to literally pick them up and use them. And that means obviously the other information doesn't need to be set. So description, if you'd like to give it a description, and MyBotGP will action a standardized description for each letter. The folders, again, what folder you'd like to file it to, just tell me what it is. Notes and tags, normally not used really. And then step 5, if you want to push this to the coding team. So again, you know, what task to create. So again, you state the tasks, and then clinical code, you know, seen in clinic and that type of thing. And that's it. And that completes the step 5 out of 5. And as soon as you save that, that moves the letter to an enable state. And it normally takes a couple of minutes, if that, to train a letter. But as James said, it's something which we will be doing. So you just have to provide us with some very basic information in terms of, you know, the folders and what tasks to create against that. That's a very sort of nominal information that's needed, and then we can actually train for you.
Thank you, Sanj.
Thank you, Sanj. Pleasure.
I'm going to stop sharing and then I'll reshare again. Okay, so what you're seeing here, essentially, imagine you were just looking over someone's shoulder. Is the best way to describe that. Ignore this stuff around not using a mouse. That's all redundant now. This lives in the cloud. So imagine you were looking over someone's shoulder. There's that letter in question. Again, for obvious reasons, it's had to be redacted. Here's a number of different letters it's been given permission to. MyBot, I'll get it to the interesting bit. MyBotGP has been given permission to action them, and you're just going to see it working. So it's just like peering over someone's shoulder who's using Docman, validating the letters, completing the templates, and triaging them, you know, to the appropriate place or person or folder or template. And this is it working, just like a person, grabbing the date, completing the template for you by itself. It's going to run through a couple of letters. It's super quick. Moved on to the next letter. It's completing that. And it's going to move on to the next letter. It's going to complete that. If there's a letter it hasn't seen before, as we said before, it's going to skip it. It will be in the audit log, and then you can open that up and give it permission just to action that letter the next time that you see it. And it's just going to keep running in the background 7 days a week, 365 days a year. The tooling runs on specific runs, different times of the day, to make sure that all of the letters are mocked up each day and they're cleared back to 0 again. And that's it. It is literally like watching a person. So I'm going to stop sharing now. Hopefully that will work. And then Sanj, John, are there any other questions?
One that I think you can address, James, from Sana, is just asking, can the system code the documents?
So thank you, John. So it will code the letter type in terms of SNOMED codes. But if you're referring to whether the tool will read the letter and make a clinical decision based on a next action, no. So hopefully that makes sense. It will pick the letter up, validate it. You can code the letter type, of course, so you know what the letter is and the correct code for that letter. And then for the letters that need to be seen by a clinician, they will be forwarded, and then medical decisions based on that letter will be made further to that by the human. John, any other questions?
Nothing as yet, just a big thank you from Sana. I believe we've answered everything else. So Sanj, you want something to add? No? Okay.
No? Okay. All right, brilliant. Well, if there's any other questions, please pop them in. We'll wait another minute or so. But just as a quick summary, we'll get this webinar onto our website in a couple of days. There are other webinars on our website. We've got bundles on there from previous webinars. The MyBotGP product range is there to be used at practice level. Your rules, your way. Yeah, and John runs our sales teams, so we will email everyone afterwards if you have any queries. Then please be in contact and we can give you more information. But I'll hang on another 30 seconds or so to see if there's any other questions. If not, then we can stop and you can get 13 minutes back, hopefully. Okay, so doesn't look like there's any more questions. Brilliant. Well, thank you very much for everyone for joining today. Thank you to John. Thank you to Sanj.